Hello, this is Dr. Gabe from First Look MRI, and this is a quick video to talk about arthrograms of the wrist before MRI. So there's a procedure called an MRI arthrogram, which means you'll get an MRI of the wrist only after contrast has been injected into a joint and the joint's distended. And we do that because it helps show ligament tears a little bit better, and sometimes cartilaginous tear of this thing called the triangular fibrocartilage. That will show up better if there's contrast in the joint. So we have a view here on the right. This is the MRI after the arthrogram, and this is an X-ray image of the arthrogram procedure. So first off, we start with the X-ray. We find positioning where we want to go. This is the radius, and these are the carpal bones. And there's a joint here called the radiocarpal joint, which we want to inject the radiocarpal joint. So this little white line here is a needle, and we're looking into the plane, so it looks really short, but it's a little bit longer than this. We're just looking down the barrel of it, and we put this into the joint, the radial aspect of the joint. A lot of times people will put it right here. I tend to put my needle over here, and once we put it in there, we'll inject contrast, and it will fill up this joint. This is again the radiocarpal joint, and if the fluid leaks into this middle area, the midcarpal compartment, or midcarpal joint, we know there must be a tear of a ligament that will allow the fluid to leak through. Also, if the fluid leaks down here into the distal radio-ulnar joint, this is the radius ulna, so they have something appropriately named radio-ulnar joint. If the contrast leaks down into the radio-ulnar joint, we know that this area here has a tear. This is the triangular fibrocartilage. So here's the needle placed. We inject the contrast, it fills up, and then we send them over to the MRI machine. Now in this view, everything's pretty dark except for contrast. The contrast has some X-ray dense material, same kind of material you'd use for CT scans that shows up really white on the X-ray. And then here on the MRI we have also gadolinium and some saline mixed in there. And so the gadolinium will show up really white on this MRI machine here. We call it hyper-intense. And so now we do the MRI machine, and again we can see that the contrast fills the joint nicely, and the contrast does not go into this mid-carpal compartment, and we see that the contrast does not go down here to fill up the distal radio-ulnar joint. And it outlines this thing here. This is the triangular fibrocartilage, so we get to see that a little bit better. So you can see why we do arthrography. And the only problem with it is that if the patient had a joint effusion, like fluid in the joint from injury or inflammation, we wouldn't see it very well because we injected fluid into that joint. But again, if they did have a tear, like a very small tear, it may be better demonstrated because we can see the contrast going right into the tear. And if they had a small tear, the ligaments here, again, we'd see that contrast trail in here, filling, and we would know that there must be a tear of one of these ligaments. And that's it, an MRI arthrogram of the wrist.